You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis. Only on 101.3 Jams.
I am HO Talk Show. Still here, still in the building, still standing for you. I am HO Talk Show online, all your platforms. Tell a friend, tell a friend. We're streaming live right now on y'all YouTube. As well as you can find archives of some of your favorites. And one of our favorites is, we're normally joined by Miss Catherine Goodman. And so a couple of her colleagues are here with us today to talk with y'all. Very, very timely, of course. They're going to school us on to our current COVID status for our area and just give us some updates on what they have going on in the community. So we are joined by Jen Fleischer and Talithia Howard. Ladies, good afternoon. How are you today?
Good afternoon. Well. Great to be here.
Well, thank you.
Thanks for asking.
Absolutely. Great resource to the community. And one thing that I like about this segment is that, regardless of what the conspiracies and things out there are, you guys have, the health professional and the scientific evidence to back the way that we should treat this thing, right? So, you guys, right now, where are we? Exactly when it comes to our area. Are we seeing a spike? What are those numbers sort of looking like right now for us, going into the fall season?
So I can answer that. This is Jen. We're definitely seeing an increase in cases largely because of the Delta variant. So looking at it really broadly, Commonwealth-wise, cases increased by 30% this week from last week, and 80% of all of those cases were Delta. And how that kind of breaks out for the health district is that Albemarle, Charlottesville, Louisa, and Nelson are having a substantial spread of COVID. And Greene County, unfortunately, is having a high spread of COVID, again, mostly due to that Delta variant. And Fluvanna is right now the only county in our district that has a moderate spread. So substantial means that there's a rate about 67% of spread kind of through the district. Now, that doesn't mean that's everyone 67% is positive, but that it's going at that rate. So it's definitely not the, late May, early June that we had where things were pretty mellow and folks were starting to come out again. It's on the rise for sure.
I got a question for her real quick when she said, because I live in Greene County. Now, when I know Greene County had a problem with people wanting to wear masks. Is it also a problem with people lying about getting vaccinated?
I can't speak to that largely because I wouldn't know if they're lying, but I can definitely say that Greene County has a vaccination rate that's pretty similar to Charlottesville and Nelson and Albemarle, hovering somewhere in the, between 60 and 65% of the whole population 12 and up is vaccinated. But certainly because we know that Delta can break through to fully vaccinated people, that number may not mean as much if you are unmasked. So whether Greene in public spaces, county residents overall are unmasked more than other counties, I don't have any data on that, but certainly masking is one of the prevention measures that can help vaccinated and unvaccinated people, and potentially could point to a higher spread.
So when you say,
are we seeing any?
Oh, go ahead, Max.
Any different symptoms for the variant versus the actual, coronavirus, the initial virus, I guess?
Yeah, the alpha, which was our predominant. That's a good question. So it tends to look in vaccinated people. It's so far reportedly it's very mild. One of the symptoms that we have heard anecdotally, and both we're starting to see some of the data come in, is that the loss in taste and smell, particularly in vaccinated people, is one of the Delta symptoms. But otherwise, and unfortunately, It's still predominantly asymptomatic for a while and then very mild symptoms in vaccinated people. Now, of course, we'd expect that because that's one of the protections vaccine gives us. But in unvaccinated people, right now we're waiting for more data to come out to determine if Delta truly does have a more acute impact on unvaccinated folks. We certainly know that since most of the variants in town and the district are Delta, and Delta causes hospitalization and death, as did Alpha, and the vast majority of those are happening on unvaccinated people, that the symptoms may not be any different, but the result is certainly the same. So it definitely makes it difficult because I think, I've definitely heard conversations like, well, for every runny nose, do I have to go get tested? And certainly if we had the resources and everyone at home had access to every test, I personally would say yes, right? Like there are symptoms that seem very, very mild, but there's no symptoms and you can be spreading the virus. So it's a really difficult place and terrain to navigate. And that's why the masking piece comes in handy as like, well, just cover your bases and wear your mask because it can be so mild or not at all and you could still have it and spread it.
Hey, question.
Did that answer your question? Sorry.
Yeah. Oh, you're good. I appreciate you guys spreading this information. One of the things that obviously we've all been seeing is that Los Angeles, New York, and also New Orleans now have gone into the mandates to where you've got to basically be vaccinated to basically do any sort of public activities, which is going to restaurants, events.
Sort of back to phase 2.
But right? Public spaces, things of that nature. But the requirement now is that you have to be vaccinated. I'm not sure if you guys can answer this question. Where are we at in Virginia currently? Where are we at local? Are our local government officials starting to think that this is going to be a thing for our particular demographic? What are you guys hearing and what are you guys seeing? If you can even share that information, or you guys might just have to say, can't answer that one, Aaron.
Can't answer that
there
one.
we go.
Wish I had a crystal ball.
And that's an answer in itself. You know that, don't you? So I'm just kidding. Right.
But I can point you to some pretty interesting things. So the Kaiser Family Foundation, which is a pretty reliable, huge foundation for public health, has what's called a vaccine monitor. And what it does is it asks huge swaths of people from all over the U.S. questions about their readiness for vaccinating, or would they get their kids vaccinated, or how do they feel, and would they change their mind if XYZ happened? And one of the questions was, how likely would you be as a person who might be hesitant or waiting to get vaccinated if say it was mandated at your school, or you were required to be vaccinated in order to do things like go to a show or go to your job? And the majority of those folks said, okay, I would get vaccinated if I was not allowed to go to work or not allowed to go to, do entertainment things unless I was vaccinated. So I would, I think that monitor is very helpful, particularly for us and for Talithia, and working directly in the community for knowing what persuade people and what is most effective in helping them feel like they understand what's going on. And I would bet that states, leveraging that are also following the global trend. I mean, look at France. It had 2 million people get vaccinated in a week after saying you couldn't go to work without being vaccinated. So it does seem to have an instant reaction. Whether our government will go that way, we just don't know.
But it sounds like currently.
Yeah, but we American. And in case you don't know,
Max says she free.
we want things our way, and we feel entitled, and we think, So I don't know about that. I don't know. I think they get more pushback before anything. I mean, telling you that I'd get vaccinated on a piece of paper, on a little survey on my computer is entirely different than sitting in someone's chair and getting that shot. So that's interesting though.
Hey Max, but when you behind me in that line in Walmart, I need you to stay 6 feet. All right, can you do that for me?
Listen, I already got my vaccine. Let me tell you. But I hear what you're saying.
So yeah, and so Jen and Salethia, ladies and gentlemen, we are joined by Jen and Salethia of the Blue Ridge Health District, talking about the current status of COVID. And so, by what you're saying, it sounds like that we are sort of back, and maybe the governor hasn't said this directly, but the instructions that you're giving folks, we're kind of back to like phase 2, right? Because, the Delta variant is the scare, right? Is essentially that our vaccine, it has pieces to it, elements of it, to where the vaccine may not, like fully protect us. So we kind of got to get back to the, to the masking everywhere and socially distancing. Is that accurate?
Well, parts of that are accurate. Yeah. So I think we do need to get back to masking and social distancing, or, to the effect where if you're going inside a crowded public space and you don't know the percentage of people there vaccinated, or who, and you don't know what your rate of Delta spread is in your town, then yeah, you just want to cover your bases and wear a mask, because you can no longer say, well, everyone here is vaccinated. Well, that doesn't necessarily mean that you are not having a Delta, case. But is the vaccine protecting you? For sure. We still know that, just like kind of, if you think about it almost as the flu vaccine, where you can still get flu with the flu vaccine, but it will likely keep you from being hospitalized or dying from flu. And that's the advantage of flu vaccine. That same kind of thinking is kind of how I explain it to folks who ask me, like, yes, you can still get COVID and be fully vaccinated, but you will have a much higher chance of having very mild symptoms, and you will have a seriously high chance of not being hospitalized and not dying from COVID. And that's the piece that's, really crucial about the virus, that there is a lot that is prevented. And some folks will not get Delta from being vaccinated. We just don't know yet the data of like, how come some people get instantly hospitalized with COVID? How come some people get no symptoms at all? So with all of that still amassing as far as data, I think it still speaks to, hey, vaccine is your best tool, but right below it is masking and distancing. And essentially that means like, don't go to a huge house party with a bunch of people you don't know without your mask on.
Jen.
Like that's how that translates. And so outside gives you more prevention, more protection.
Yeah, open air.
But but it's kind of like, but does it feel like version 1.0? Yeah, it does.
Jen, I got a question for y'all.
Yeah.
I know, it's not fun.
Max, let me ask this question real quick. All right, I recently got my first shot, so I'm scheduled to go back for my second one tomorrow.
Yay!
Wait a minute now. Wait a minute.
Come on.
No, I'm just playing.
He also didn't say what it was either.
This was.
He didn't say it was a vaccine.
Look at him. Look, and but I do have a question.
It's his sense of humor, Jen. It's his sense of humor.
I do have a serious question though. The people that were in there for the first time, because a lot of people were vaccinated before I was. So, but the people that were in there with me were sent by their doctor because they had underlying issues. Is there any knowledge of which of the 3 shots worked better for, like, say, diabetes or some of the other underlying issues? Or y'all still don't have that information either?
We still don't have that. That's emerging data. So what we do know, what we're just starting to see is how they all react as far as protection of spreading Delta. And again, that's all emerging as well. So there's no, there's nothing I can give you that's solid on that. But I'm still allowed to cheer that you got your shot, because also that means that you have the most efficable shot. Like, you have a lot more protection than I do, someone who got a shot a while ago. So I feel I'm really excited for you.
Now, will I still have to get the booster?
Excited for you.
The
booster?
Yeah, will I still need the boost since I'm getting mine so late into it, and I'm sure they've added some different things to the shot. Will I still be under the same requirements of the booster like they're asking everybody else?
So there's nothing added to the shot. It's still the same drug that we have been using, Pfizer, Moderna, or J&J. Yeah, so it's just getting that extra dose in at least 28 days after your completion of your cycle, your two-dose cycle, And right now, J&J does not require a booster. So it's just those who got Pfizer or Moderna. And yes, I think the recommendation does not have a timeline on it because there just is so much unknown. By the time you finish your second dose, 28 days later, should you get a booster? The recommendation as of now is yes. Could that change by the time you're ready for that booster? Yes. Could there be another variant that needs a different booster? Yes. So it's hard. We're in a really, and I'm not the epidemiology part of the Blue Ridge Health District. I really work on vaccine and planning and working with Talithia to get it into neighborhoods and get it to gas stations and to, churches and all the localities and wherever people need to be met to get the vaccine, again, as their best defense against COVID. That being said, what I have learned from the epidemiologists is the predictions are the best we have, and they come in slowly, and we wait for the facts and we roll with the punches, and we do our best to plan with that data we get, but nothing is solid.
Okay.
Cool. So how about this?
Yeah, I just feel like we need some.
Go ahead, Max.
Yeah, no, I was just going to add that I just feel like we need some, cut and dry direction. When dealing with this whole health pandemic, because the mixed messaging I feel as far as the governor recommending what the CDC recommends, but leaving it up to the localities to determine whether or not they're going to follow the CDC's instruction, and then the localities
That's
saying
tough.
yes or no and things like that. I just there's too much room, especially with such high risk.
But Max,
There's too much room for.
They can't do that in the medical profession because their license says right to practice. Medicine is not an exact science, and that's coming from a person like me understanding that it migrates. Like you're talking about the human body, which is a mystery in itself, and now you're talking about. I believe in global warming. I believe that there's diseases and stuff in the ice that are coming out here. So they have to, even though I have the shot, I don't trust it at all just because of what has happened in Tuskegee Airmen and everything else, right? Like when I got the shot, I have absolutely no trust in the health system because I don't think it was designed for me as a black person. But if it gives me the opportunity to at least have a fighting chance, that's why I did it for my kids, not for myself.
Right, and that alludes to what she said earlier. It's kind of like whatever it takes to get people to get it, because whether you're talking about like weighing the risk versus reward for getting the shot versus not, it's kind of the same thing as social distancing and masking. It's like with all our freedoms, right, we still should be respectful of other people.
Of others,
you know what I mean? Yeah. So it's like regardless of how we feel personally. And I'm sure, and this is a great segue, actually, Talithia, on what's going on for the community and the schools. That school is about to start, because like y'all probably seen some of the school board meetings and whatnot. I mean, there's people up in arms about they're just because their kids are being mandated to wear masks. Yeah. It's like, and again, like we're kind of so far down this path now to where we're just like our sense of freedom is twisted to where it's like we can't even respect our neighbor enough to be like, just give me a few feet. Or like when you're that close, can you put a mask on? It's like, why is that so difficult?
But why are you like, why would it be any different than, I mean, your grandparents and my grandparents were put into slavery. So it's never been respected as a whole. So it's just more of the same.
I feel you. Yeah. And and this is something that has affected everybody, right? Regardless of your race, color, creed. And to that point, it just blows my mind on like how some folk are like, to your point exactly. It's like some people are so surprised that there's people that's being this rebellious and this disrespectful of others' personal space and whatnot. It's like some of us been experiencing this kind of anger.
Anybody that will storm the Capitol, don't care nothing about you wearing your mask and 6 feet.
Facts. But so community outreach and schools starting back up. Like, what can y'all tell us about what's being offered there, and maybe things that parents and the kids should be prepping for?
So I'll just tell you the school part, but I'll let Talithia tell you what she's been doing, which has been extremely effective. And it's just because it's old fashioned community, meet you where you are, knock on your door and come out stuff. But from the scheduling perspective, we are planning with the schools right now to have vaccine clinics either on site or during football games, so that, you know, we have a mobile unit, so we're pretty flexible and we can roll out really anywhere, so that we can help folks, because remember, these are minors, so they need consent from an adult in order to be vaccinated. And so that's hard on any, you know, guardian, parent, family member who wants a youth to be vaccinated if they have to take off work and kind of help that process. So we're working with the schools to make that easier for kids. And then the mask mandate does really assist with taking the guesswork out of it. Max, it is difficult to be in the gray a lot. And so it's, I think, you know, knowing that everyone needs to wear a mask is relieving, particularly for parents who believe in that science and had been counter to their school county's decisions originally. Now everyone's on the same page. So that's how we're supporting schools. But Talithia, why don't you go ahead and talk about what you've been doing, you know, to help parents and kids in their neighborhoods?
Yeah.
So I have been going door to door in different communities, different neighborhoods, just knocking on the door, giving any information that anybody would need far as the facts about the COVID, what we can do to get your vaccine. I have put on plenty community vaccine clinics, different areas. I've been at Townsville Park. We're at Cherry Avenue. I've been in different communities. I've been at Park Edge. I've been at Friendship Court. So I'm pretty much going everywhere where I know people live at that are hesitant, asking questions if they trying to get them the information and the education that if they want the vaccine, that they are able to get it.
Talithia, one question.
What seems to be maybe like the most frequently asked question when you hold these little meetings?
So for me, I'm sorry. Were you still talking? Or
Nope. I was just asking you about the most frequently asked question. So
the most frequently asked questions that I have came in contact with is, am I going to die? What's in the vaccine? That's pretty much it. And then it's just other things, the side effects of if I get the vaccine, what are the side effects that I will come into?
Talithia, I got a question for you real quick.
Yes.
It seems that with the vaccine, we've gotten a lot more lax with where we'll give the shots. Because when it came to like medicine beforehand, it seemed like they wanted more of a closed environment. But because of the pandemic, it seems like anywhere that they can administer the shot, they'll give it to you. So I'm wondering, maybe not for you, but for other localities, is sanitation possibly an issue?
So for me, I would say that it has been on a comfort level of more people wanting to get the shot. So with me, I'm trying to meet people where they're at. So if you're comfortable with me coming in your community, your house, I'm gonna come where you need me to come so you can get the shot, so you will feel safe. And I'm gonna make sure everything is clean for you. So we have a mobile unit that we have now that we just go out in the communities in the neighborhood. So for me, I'm just trying to meet everybody where they're at, that if they do want the vaccine, that they don't always have to go to, well, we had JCPenney's, but now we're at J. Crew. So with me, I'm just trying to make sure everybody's comfortable with where they are with getting the shot. So if it's in your house, we can come in your house and do it. If it's outside at the mobile unit, when you step outside your door, I can give it to you there. Like, I'm trying to help you wherever you want to be comfortable to getting the shot and feel safe of getting it.
Okay.
And I actually agree with that, Talithia, 100%, because I think accessibility is key. And for the people or communities of people that the virus seems to be impacting the most, and who have the least resources, I think that you have to meet them where they are. So yeah, I think that's definitely a good method to it.
Hey, I have a question.
And I can speak. Oh, sorry.
No,
I was
go
going
ahead,
to just
Jen.
add
No, go
to
ahead,
that,
Jen.
like the, you know, every time we're vaccinated, it's not just like running out with a syringe, being like, "Come here!" It's
it seemed like it.
I know it made me feel like it, but it's we always roll out with 2 nurses, and then we have a medical observer who sits with you after the shot to make sure you're feeling all right. And, we carry all the medical equipment. We're really a mobile moving clinic. So the sanitation is, absolutely part of it and required. We absolutely could not, vaccinate without that, but it's essentially like going to almost like going to an on-demand doctor's office. So, we've got a lot of eyes on you while the whole process goes on from start to finish. But I just wanted to add that in.
Thank you.
No, hey guys, I had a question for you. I know that we're all experiencing COVID like real time right now. I know that might seem like an oxymoron.
That's a great way to put it.
We're experiencing it in real time, and I've been reading a lot of articles. Just read one in the Harvard Press, and they're talking about what exactly this is going to look like in the future. And I know you guys don't have a crystal ball, but I mean, one of the articles had stated that COVID will eventually become something that is treated like the flu, that'll have a little bit harsher effect on our children than it would for us. And then other articles have stated this thing might become something that we just eliminated.
Yeah.
As a society, though, what do you guys think? Is vaccinations going to help us get closer to where we're supposed to go in reference to a society is getting healthy? Or is this something that is just going to have to play its course? It's just going to do what it do regardless of what we do as individuals. Does that kind of make sense a little bit?
Charles, you should take a break and let them think about that one, because that one hit home, man. That was a good question, man.
That's what he said.
No, I think that's a really good question. Like, are we in this forevermore? Or like, what does this look like in the future? And I think that again, I'm not a virologist or an epidemiologist, but that everyone's goal is let's get it to endemic. So the only disease we've ever kind of, smallpox is the most recent one we've totally eradicated, right? But measles and mumps still live here. And we don't have a radio show about measles and mumps because we only have outbreaks at limited times when people are under vaccinated in certain, next to the woods. So for example, Oregon, couple years ago, state of emergency, measles and mumps, because not enough people were vaccinated against it. So do I think vaccination is the way forward? Yes. Do I think it's the only way forward? No. I mean, I certainly think that we may become a masked, norm. Masking
you might
may
need
be
to
the
repeat
norm.
that, Jen. You might need to repeat that because so many humans at this side of the world are not coming to the realization. And I want you to continue, but you and I both know there are other countries to where people just walk around with masks all day long.
So this is what I said. I was like, if we lived in these countries where masking is totally normal, you may notice that like in news, AP photos you see of other countries, particularly in like Southeast Asia, where masking is the norm. Everyone just has a plain, medical mask on. And I was like, oh, did they already go through the phases where they had cute masks and now just they've been wearing it for so long? There's this plain old like blue mask.
Right.
But that's what it is. We're going to have to destigmatize the mask, which we're going to have to unravel and then just maybe wear a mask for a long time because it would be very difficult at this phase to say, like, to put money on that we're going to eradicate COVID. I would love that I felt like betting on that right now today, but I just don't know enough to make that bet. So I've got to go with the more middle ground that says, okay, everything we're doing, if more people get on board and get vaccinated, because again, we're hovering around 60% in the whole district, all 6 of these counties, right? That's pretty good, but that's not, if 60% of us were vaccinated against measles, we would have measles outbreaks right now, right? Like that's just not enough. So that with masking is really what we're going to have to do until we get really it to be the norm to be vaccinated. And until then, and then maybe some awesome other technology will come up and we get even better fighting tools. But, look, we're just the U.S. and we're just Virginia. You look at the world and it's not 60% everywhere else. Right. And there's a lot of fluidity in people coming in and out of countries and migrating and moving. And until we get everybody caught up, then it's going to be a long haul. So I hate to be a bummer. I'm always telling people
but we need this information.
I am
we need the truth.
Don't bring me to a dinner party. I'm like the darkest guest you can have. But like, it's just, I want everyone to just get, look, we're going to have to move to some sort of normalcy with this in order to move on with our lives.
Yeah.
And that's part of it.
Yeah. And medicine is medicine. I tell people a lot of times, like, I would love, that if we can get to the point to where we have enough self-care and wellness to where the body can do what God intended to do and the earth could heal itself. But I feel like that we've just polluted, ourselves so much to where, whether we like it or not, medicine is medicine. Sometimes you got to fix one issue that's going to cause another issue. That's kind of where we at as a world right now. So I think, so if we can get back to that whole the wholeness of wellness, who knows? Who knows?
Hey, Charles, it's crazy because when we was coming up as kids, like when you met somebody, like say, 16, 17, whatever, you had to worry about catching STDs and AIDS. Now you got to worry about just talking to somebody and catching COVID. This ain't fair to these kids.
Not at all. So we better do something different for the future.
And speaking of, normalizing.
I still want you to worry about STD and AIDS.
Hey, look, hold on. Hold on. Hey, Max, we ain't wrapping it up. We masking it up.
Hey, you come in that joker looking like a Dollar Tree balloon up in that joker. What you trying to do, Shorty? What you trying to do?
Hey, but quick comment and question, Janet. I think we're getting ready to wrap up. Speaking of normalizing masks, my now 5-year-old and 6-year-old wore a mask throughout the winter while attending daycare. They did not catch a single cold last winter, whereas before they were getting a cold every 6 to 8 weeks.
Yeah. More than that.
And so I think there's something to be, something to be said about that. But my question to you, though, is that I've read some things about animals testing positive for COVID. I don't know if the stories were accurate or not, but I am interested in what you may know about that, because as Razor mentioned earlier, I talked about this virus affecting our kids, and well, here we are. And then what if it starts to affect our animals, like livestock, the things that we use as nourishment for our bodies? So,
not even that, just somebody walking around with them little dogs in their pocket and everybody walking up petting them.
I don't want the Rona in my chicken. I'm just saying.
Cook it at 165. That's internal temperature.
I don't know. I think pocket dogs maybe are not my favorite, but I think that the real problem is that we do know that, for example, you may remember from early in the spring, or it might have even been the winter, forgive my timing, I can't remember, but like minks definitely get COVID, right? And they had to the German minks plants and had to kind of cull herds. I don't have a lot of data on, do domesticated animals carry COVID? I know that they are vigilantly watching that, though. That's like a whole arm of epidemiology and veterinary public health that keep an eye on that spread. So, Max, I'm sorry, I don't have any good data for you, but I can reassure you that there are teams constantly looking for any sign of that happening and crossing into a barrier of like, okay, it's poisoning our food chain. That for sure stays as vigilant as watching the kids in the human population. But yeah, as of now, I don't know.
Well, listen, if you hear anything, you come back on here, okay? Like
absolutely.
Said, I don't want the Rona in my chicken.
No, it's true. It's true. Do I have to tell the pocket dog people that it gets into pocket dogs? I don't know. I might let this.
Hey, no, I will wrap it up.
I'll absolutely let you know here. And that's our job. Like we hope to have everyone to let it be as black and white as possible, and to be as in front and in planning out ahead of what's coming down the pipe. Like that means that we're doing our job well as a health district. And so, we're so honored to be on the show and to be able to talk to you and say what the plans are and what we're looking at, and know that what's on our radar. And we're happy to help.
Thank you. So,
thank you. We appreciate that.
Absolutely. So, any closing message, last word, the contact information?
Sure. So, if you just look at blueridgehd.org, that'll tell you everywhere we are throughout the district, and can connect you to, like Talithia said, homebound vaccines. We run a homebound service Tuesday through Thursday every week. You can request a mobile vaccination in your neighborhood, and we have a whole system to orchestrate that. And then we have our health departments each offer in each locality vaccination 1 day a week, as well as testing starts this week. So, keep your eye on symptoms and keep wearing your mask, and that should cover you. Awesome. Literally.
That's right.
Yeah.
Yeah. So Jen and Talithia, thank you all for joining us, and keep up the good work, trying to keep our community healthy and safe, and hope to talk to you again soon.
Thank you so much.
All right, take care.
You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis, only on 101.3 Jams.